I think nowadays, more and more people are practicing this thing called prejuvenation, where we start to tackle the signs of aging even before they start to manifest or even before they become too serious.
Can you share with us why it's important to not neglect the skin around the eyes?
So the skin around the eye tends to be slightly thinner than the rest of the face, and as a result, as we lose collagen over the years, the skin around the eye tends to show time a little faster than the rest of the face. So you start to get fine lines, a bit of laxity, and you start to see all these crow's feet coming out.
So how does Thermage help with the crow's feet and the fine lines?
You basically use this monopolar capacitive radiofrequency, and it gently heats up the skin around the eye and the rest of the face. And when doing so, it actually stimulates collagen growth and production around these areas and helps to fill up the fine lines. So you can think of it as ironing out the wrinkles and the fine lines around the eyes. Thermage can be used anywhere there is skin. The tip will be obviously different. So you have a special tip for the eye alone. There's a tip for the face, and then there's actually a tip for the body as well. For Thermage to be applied to the eye, we're using the eye tip, which is a dedicated tip. And if you want to do something for like the forehead, maybe just a little bit on the lower face, you can use the 4.0 tip. It's a newer tip, it's faster, it's a bit more comfortable. The heat is being applied more accurately, and with the number of shots I can adjust. So if I can use 300 shots, I can use 600 shots or even 900 shots to treat portions of the face or the entire face and neck.
So what does the Thermage treatment feel like on your skin?
It feels like a warm kind of sensation. The heat gradually builds up, and there's actually a bit of cooling sensation that's being applied to the skin at the same time while the pulse is being administered. So I would say that the Thermage is not 100% painless, but it's extremely comfortable. I find that Thermage works really well for around the eyes, for the crow's feet, for the fine lines under the eyes, even maybe for the forehead area. But for the lower face, I like to use Ultherapy or ultrasound. So the main thing about Thermage is, sure, you may see a bit of instant lift, but that's usually due to the heat energy and the acute collagen contraction. However, results actually do get better over the next maybe 60 to 90 days as new collagen is being produced. So I like to tell my patients that, hey, you know what you see right now may not be the final result. The result does get better.
So I've done skin boosters and Botox on my face. Can I still do Thermage?
Oh, of course. I wouldn't recommend doing it too close together, but having skin boosters or Botox treatments do not exclude you from Thermage treatments.
So it is possible to have Thermage done on places that you've done laser treatments on before, right?
Thermage is a color-blind treatment. It basically works on the principle of heating, so it doesn't target a chromophore. Even areas with pigmentation, tattoos are okay to be treated with Thermage.
So should one wait for their face to sag and wrinkle before they do Thermage?
I think nowadays, more and more people are practicing this thing called prejuvenation, where we start to tackle the signs of aging even before they start to manifest or even before they become too serious. I guess a little bit goes a long way. So if you nip the problem in the bud when it's in the infancy stage, you're going to be spending less money, you're going to be using a lot less invasive treatments in order to treat your problems.